Assalamu alaikum dear doctors, I am Dr. Azhar today with a new topic for MRCGP learning. Today my topic is obstructive sleep apnea. This is very important topic according to exam point of view. How the patient will present. Patient can come to you and he can complain that doctor I have very loud snoring at night and my family is disturbed because of this. Or he can say that doctor whole day I am feeling very sleepy. I am feeling tired. When I wake up early morning, my throat or my mouth is feels very dry. Sometimes he feel that he is depressed, loss of interest, even loss of interest in sexual activity. He can say you that doctor my weight is increasing day by day, or he will say doctor it is difficulty in breathing at night, even I am taking 3 4 pillows still I feel difficulty in breathing. And daytime it is difficult for me to focus on the things. I pass urine at night many times. Sometimes I walk during night. Sometimes the relative will come, relative of the patient, and he will complain these things, and even he will say that this our patient at night during snoring his breathing stop for few moments and he gasp and suddenly then he wake up. Now, what questions you can ask? Of course, about weight. Very important question. You can ask his BMI, or you will say that I will check your weight here. Ask about evening consumption of alcohol. Ask about taking any sedatives at evening. Ask about his neck circumference if he knows, or measure the neck circumference in your clinic. If it is more than 43 centimeter, it means this is going towards the diagnosis of obstructive sleep apnea. Ask about smoking. Ask about large tonsils, any problem in the throat before. Ask about nasal congestion. Ask about receding jaw, that when you sleep, your jaw go back or not. Ask about tongue fall in the throat at night. Dear doctors, this was the history. Now, how you will explain this diagnosis to the patient? You will say, in this case, the muscles of the airway, which we say in medical terminology, pharyngeal muscles, they collapse completely for few seconds, and it become difficult for the air to go into your lungs, and then you wake up because signals are coming from the brain to wake you up. Then you wake up for few seconds. It can happen few times, or it can happen more than 100 times per night. This was the explanation. Dear doctors, now what test you can write for this type of patient? Only thyroid function test, because thyroid disease also can increase weight and it is one of the cause of obstructive sleep apnea. Now, where to refer this type of patient? According to his complaint, if he have nasal or throat problem, refer to ENT. If problem in his jaw or denture, refer to dentist. But surely you will refer him to sleep unit also, where they will diagnose this case and manage this case. According to BMI, if he is morbid obese or he have comorbidities with BMI more than 35, you can refer to bariatric surgery also. Now he will ask you, doctor, what I will do for the time being? Then you can advise him that there are nasal devices which will keep your nose open during sleeping. Or if there is tongue fall or jaw receding, you can advise mandibular devices. There is also strap, chin strap. It will hold your mouth close and you will breathe from the nose. There is CPAP, which he can use at night, and it will keep his breathing normal. Also, advise about weight loss, diet plan. If needed, refer to dietitian also. Also, advise about that your bed should be high from head side. Put some blocks under the foot of the bed on head side. Reduce the number of pillows. Dear doctors, I hope you understand my lecture. Please like this video, subscribe my video if you already not subscribed, and take care of yourself. See you in the next video. Assalamu alaikum.